Welcome to our review on assistive devices. We're going to start by reviewing crutches. Who needs to use crutches? Crutches are used for patients that have injured one extremity or they have an unsteady gait and they need support from both sides of their body. How do you fit it to your patient? Well, the crutches should be 2 inches or 3 fingers width below the armpit, and their arms should be comfortably bent at the elbow. When using crutches, a patient can use one of 4 different gaits. There is a 2-point gait, a 3-point gait, a swing-through gait, which is a variation of the 3-point gait, and a 4-point gait. With 2-point gait, you move the crutch and the opposite foot at the same time. With 3-point gait, an injured leg is lifted and your other leg hops forward. Swing through is like 3-point, but you travel further. 4-point gait is crutch, opposite foot, crutch, opposite foot. When going up and down stairs, remember up with the good leg, down with the bad leg. Going upstairs, the patient moves the good leg first, then moves the crutches, and then the bad leg. Going downstairs, the patient moves the crutches down, then the bad leg, then the good leg. A patient will use a cane if they have a weak side and a strong side, and they only need support on one side of their body. How you fit it to your patient is the top of the cane should be level with the hip joint, and the arm should be comfortably bent at the elbow. A cane should always be held on the patient's strong side. Remember, C-O-A-L or cole. Cane is held opposite of the affected leg. The patient will move the cane forward, then the weak leg, and then the strong leg. When using a cane up and down stairs, it's the same premise as crutches. Remember, up with the good leg, down with the bad. When going upstairs, the patient will move their good leg up, then the cane, then their bad leg. When going downstairs, the patient will move the cane first, then the bad leg, then the good leg. Next, let's talk about walkers. Who needs a walker? Well, any patient who has a weak side and a strong side, but still needs support on both sides of the body. It's kind of a combination between the needs of crutches and canes. How do we fit it to our patient? The top of the walker should be waist high. When using a walker, the patient should move the walker ahead first, then move the weak leg followed by the strong leg. Remember, wandering Wilma's always late, meaning move the walker with the affected leg, the weak leg. Sometimes we may use a slide board for our patient. Slide boards are typically used with quadriplegic patients or patients who are unable to bear weight on their legs, but they have good upper body strength. How to use it is you'll position your patient higher than the chair or the surface they want to go to. The slide board is going to be positioned underneath their bottom on the strongest side, and the patient's going to grab the handle at the base. They're going to pull themselves with their upper body down into the chair. Additionally, we don't want to forget about gait belts. Lots of patients use gait belts in a hospital setting. It's when they need a small amount of assistance when ambulating or transferring, and it's really common when someone's recovering from surgery. How we use it is we fit a gait belt around the patient's waist. You want to be careful not to drop it too low around the abdomen because squeezing their abdomen can be harmful. You're going to stand on your patient's weaker side and hold on to the loops on the gait belt. You want to be slightly behind your patient in case they start to fall and you need to assist them to the ground. Thanks for watching.